We will now call the meeting to order. Was the meeting properly noticed?
Yes, it was.
Roll call.
Mr. Shelton is not here. Otherwise, the other four are present.
And what about online?
Becky Pease, are you online?
Yes, I'm here.
All right, there we go.
I'm here too.
And Teresa.
Yeah, I can see
Okay,
Teresa. I
okay.
just can't see.
Yeah, Terry's here.
Okay. A motion to approve the agenda. Motion by Hickler, second by Pease to approve the agenda. Any discussion? All in favor?
Aye.
Agenda approved. Is there any questions on the meeting minutes?
Oh,
If not, we'll approve those as printed. Public participation. We will take as needed. Correspondence.
I have none.
We have no one here to do the project status report.
No, that's Kelly.
It's Kelly. Oh, okay. Sorry, Kelly.
I don't really have anything to update on our project status report. I believe two things were updated. One was related to the Aging and Disability Services Division. Just to note that we have finally hired an ADRC supervisor. Yay.
Yeah.
And she will begin in 2 weeks,
Okay.
and very excited to have her. And may need to look at that area a little bit to make sure it's accommodating for the supervisor and change of duties. So very exciting. And then we continue to monitor and supervise staff that are working telework. And just a reminder to all of you, we do keep a running document that indicates work location, and that's always done in advance if staff are working telework. That's it.
Very good. Any questions? Supervisor Pease,
I think I'll wait for Kelly's.
her other report.
Yes,
Okay. Veteran service, are they, okay, did anybody have any questions of them? Okay. Moving along, report of Health and Human Services Department, Director's Report and Manager Narratives. Kelly?
I would just ask if there were any questions.
Kelly, with the person that you want to be hired, the case manager at Practical Sense, will that person be in-house 40 hours a week? Do they have room in there for office space? How's that? How do you see that picture going?
I think we will have to be creative to use the space that we have at Practical Sense. The position would be located at Practical Sense. It would be 40 hours a week with the expectation that they are at the store because we really need an extra set of hands at the store also. So this would not, I don't envision this having telework capacities for the most part.
I've had that question a couple of times, so I want to make sure it was on the record. Thank you.
Supervisor
I just
Hickler?
want to say what, Cody, I thought you did an outstanding job on that vaccine. Providing that and working with that pharmacy, everything, seems like the numbers are up, but people said a lot of good comments.
Yes, thank you.
I'd like to second that. Was going to be one of my comments too. It was an excellent job. Thank you.
Thank you.
I do have a question about Practical Sense. They've got a lot of stuff in there. Do they resell or move some of that clothing out to other agencies or anything?
So, like if there is clothing or linens that are not in good condition, we do have that semi next to Practical Sense, and that's used for textile donation, and we get a small amount of revenue for those items. Right now, we have a significant amount of donations. Of the staff who've been there for quite some time, they can't remember a time that we've had this many donations. So we are struggling to keep up with all the donations right now, and hopeful that they'll be able to move through some of them right before the holidays to try to get in a better shape. But the amount of donations coming in is overwhelming right now,
Good
which
and-
is a
good and
great
bad.
thing. It's just space wise, we're tight. We're very tight.
Okay. Supervisor Pease.
Is there any way that the back area where the garbage is, you could maybe bring in 1 or 2 semis and put overflow in there? Because I was told at some point too that it could be a hazard for some of the workers there, and I'm kind of worried about that.
Yeah, I think that's a great point. Something we need to clarify is zoning to make sure that we're able to bring in like a pad or some sort of unit. And then we have to make sure we're able to move through those items. They just don't sit there. So a lot of conversation about how to move through those items, where to store those items, and keep it safe.
Yeah, I have to go along with that comment also. I've heard comments from the community that with the way the boxes are stacked up in there, that it's a hazard.
They're definitely stacked.
Okay. And then I have a question on the behavior health. That stats page is always towards the end. That one. Okay, Bridgeway is on there. But they never, their report's always 0. What is it?
Bridgeway was a stabilization unit outside of Marshfield. It was attached with Norwood. My understanding is Bridgeway is no longer a viable option. I don't
Okay.
know if they're still open. So Adam could probably remove that. We had utilized them quite a bit in the past.
Okay, I just noticed for the year that they were all 0s. Anyone else have any questions? Comments? Okay, moving along. Financial report. Anyone have any questions on that? Seeing none. Report of committee members, the Coordinated Services Advisory Committee.
I can do that. Aaron Kabilski provided a quick update. So the Adams County Coordinated Services Advisory Committee met on October 14th at Health and Human Services. Supervisor Pease attended the meeting in place of Supervisor Hickethier. The meeting provided education and insight into the summer experience program, discussed the 2025 activities and participation numbers for each event at the summer experience. There continues to be growing interest and increased attendance in this program each year. This program allows collaboration between the Coordinated Services Division and the Children and Family Services Division. An update was provided by other committee members regarding activities and events in the community. Supervisor Pease requests that the CCS leads reach out to surrounding school districts to see if they would also be interested in participating in the meeting. Our next meeting is scheduled for January 13th at 9 a.m.
Any comments or questions?
Going back to what Aaron said about the summer stuff, that program and her presentation was outstanding. It gave a good picture of what was going on in that area and how many kids it was helping. So if you go back online and watch it, I think it will be good for anybody on this committee.
Thank you. Public health, community outreach and education presentation. Corey?
Good afternoon. If you could zoom in just a little bit, Leanna, that'd be great. Leanna, sorry. Perfect. Or, yeah. Okay, so I just wanted to showcase some of the community engagement public health is doing. Oftentimes, when you hear public health, you think about vaccines, communicable diseases, or health outcomes. So this evening, I just wanted to showcase some pictures and do some descriptions through to talk about some things that we've been working on. So next slide. With our community action teams, we focused on a lot of nutrition for this summer. We had some funding that we want to designate to the local county farms. Through this program, we wanted to prevent heat stroke and heat exhaustion. So for 3 months, June, July, and August, we were able to impact 1,035 farm workers at 7 farms, impacting close to about 1,100 families and farm workers. Sharps Drive, this is something that was newly implemented this year with public health. We wanted to implement this with the senior fair after having a lot of discussions with Donna and her team. So we took it on this summer, I believe it was July or August, where we held the Adams County Sharps Drive. We were able to hold it for 3 hours, but the 4th hour, we filled the DHS vehicle. We collected over 180 pounds. And this is something that we're going to continue to do annually, maybe during the senior fair moving forward. This way we had that population there and readily available. Since the event ended an hour early, just because we filled the vehicle with all the sharps that we were collected. And this also kind of goes hand in hand with our community health assessments and getting those sharps off the streets. In July, we worked with the state to hold a tabletop exercise on emergency preparedness. The discussion was around the county fair as an exercise in a measles outbreak. I was able to work with the team and the state and public health on how we can prepare better with our hospitals and key community stakeholders on if there was a communicable disease outbreak. We are very close with Adams County Drug Free and Sheila with UW Extension. So some of the events that we do for public health and extension and our Drug Free Coalition is Narcan, movie showings, and drug free and sober events that we can do for the community. Since we are connected with the Narcan distribution for the state, we're able to offer Narcan kits for every community member that comes in as well. Men's Night Out, that was something that public health has been planning with the community for the past 3 or 4 years. We were able to successfully hold this event this year because we had an intern that was able to assist with us. The event was about showcasing what Adams County all has to offer from health, resources, clubs, groups, and more. We had about 80 men that turned out to the event. And we also had about 20 raffle baskets to raffle off as well. Strategic planning and campaigns, that's something that I like to take a lot of pride in. I like to identify our target populations. As you can see, if you're heading north to Wisconsin Rapids area, you might still see our prevention billboard for vaccines. We decided to target the senior population and the farmers this year regarding flu vaccines. So you can see a farmer there on the billboard, and you can still see it today if you head that way. And then with our aging populations, we like to go on the radio a lot because with social media and a lot of the campaigns that we do, they're not able to witness those. So being able to do those on the radio goes a long way for our community. We also partnered with the United Way in Southwood counties this summer. We held a diaper drive. These diapers go back to WIC, first-time moms, and parents that are in need. I'm also a big firm believer on building relationships, and that it's the cornerstone of the effective public health work that we do in practice. It also contributes to a lot of improved health outcomes that we've been doing as a team and in the county and the community, as well as health and human services. So when it comes to strategic planning and doing public events and working with the community, we take a lot of pride in building those relationships to kind of give back to the county and do more. The Suicide Prevention Walk was held in September. We have a very supportive community. This year was one of our biggest events. We had the Coloma Creamery donate ice cream for us this year. We had over 240 people attend the event, which was the biggest in the event's history. and almost $6,000 in donations, not including almost 30 raffle baskets as well. And the next few slides here are just some more community outreach and education. So a lot of today's presentation is about a fourth of what public health does, but a lot of it is community engagement and outreach with education. So at the Adams Friendship School District Open House, we talk about mental health, getting your child up to date on vaccines for the school year and areas like that. We're also a big advocate for rural partnerships. Working together is the best way to support the healthy people and places of Adams County. It's vital for advancing public health initiatives. So I'm very fortunate with some of the partnerships that we've had. Recently, we've worked with O'Connell Pharmacy. I know we talked a little bit about flu vaccines earlier. And then our partnership with WIC and Noble Community Clinics to bring in a dental hygienist quarterly, which eventually you'll hear about the pediatric mobile unit that will intertwine with that as well. In the last few slides here, again, to kind of get community engagement and build relationships and trust within the community, farmers markets, the senior fair, these, and even Kids Day, which is on the next slide. These are just ways that we can foster and build relationships with those in the community and growing into it. I also take a lot of pride in advocating for rural counties and developing equitable public health outcomes. So I worked with UW-Madison this summer and UW Extension to give presentations and along at the state public health conferences to kind of talk about building narrative and relationship building in rural counties. And on our last slide here, you might be wondering what's coming up next for public health. We are due for state statute on our community health survey. The community health assessment is what drives public health work for the next 5 years. So we're going to be implementing a survey to the community to get more feedback on how we can do better and advance more public health initiatives. And then coming up in the next month and a half will be the Parade of Trees with Amplify in Gunderson, where we'll showcase some of our mental health outcomes and supplies there on some trees. And I'll open up if there's any questions with those.
Supervisor Hector?
Cody, just one question. You have a boatload of sharps there. What happens with to those? Where do they go?
Yep. So DHS takes those back, and I believe there's a recycling facility out in Madison that takes care of those. But I don't know where they go outside of once Madison takes those in the state.
Okay. Just curious. Thanks.
Supervisor Pease?
Cody, your very first one, you went to farmers, and obviously there is some migrant workers with it. Was there any trouble getting into seeing where a government agency to see those individuals, and any pushback that nobody wanted to talk to the government?
I don't think so. I think once the owners of the farms understood our mission, they were very supportive. They even offered to give farm tours to my staff going there, which was really nice to see. To have them open up those relationships and engagement with the public health team was really nice to see. So there wasn't any pushback. There was a couple language barriers, but we do work with UW Extension and Yesenia on that end to kind of navigate through those, but there wasn't any pushback. They were very supportive of our efforts.
So,
Thank you, Madam Chair. Last thing I'll say is I love the presentation. I would love to see the background be Adams County pictures.
Yeah, I see a mountain there. So
The very first one was the Rocky Mountains or something. I thought to myself, maybe it'd be really, some of those pictures would be really nice to highlight Adams County. Just
absolutely.
something in the future.
We'll definitely do that.
yeah, Rabbit Rock. Okay, thank you, Cody.
Thank you.
Very, very good presentation. Appreciate it. Kelly, do you mind? We're gonna skip back to Terry. He's here now for the Veteran Service Report.
Hello, everyone. My apologies for being late. We had people walking in looking for gas cards and food vouchers. It's been a rough day. We had 46 client appointments, 12 outreach and health and welfare checks, 356 phone calls, 430 emails, and 15 VA team messages. On October 10th, Rick did a tour of Merrimont Behavioral Health Tour down in Madison. They take VA payments for veteran mental health and substance abuse issues. We're trying to find other means and places to take veterans that work solely like with veterans per se. When it comes to PTSDs and different things of that nature, since we have some issues in our county. October 13th, we had our mandatory county in-service training. October 16th, we attended VFW. I attended the VFW auxiliary briefing of spouse widowers and their benefits when a veteran passes, which is very big in this county. A lot of spouses do not realize what they're entitled to. October 20th through the 24th, we were at a conference for recertification of accreditation through the American Legion, VFW, WDVA, and VA access to the different VBMS program. We also used that time for VSOs to research different records that we have, some weird cases, and learn how to file and track certain veteran claims at that conference as well. Our veteran service goals are to provide excellent services to veterans and their families, provide community programs for elderly veterans, provide community awareness in reference to veteran benefits, and that would be all. If anybody has any questions.
Questions, anyone? I have one, and it came up after your presentation at the auxiliary. Is that for just Vietnam vets, widows, or is that all?
That's for all veteran spouses, but Vietnam is right now, I'm probably losing about 5 to 6 a month or more. And I am in the process, and that wasn't put on this list as well, but Bethany Spa, our county medical examiner, and I work hand in hand to make sure that we are able to help the spouses out. So she'll call me and say, I have a veteran that passed, and we'll talk about it if the spouse gives permission, obviously. But so far, we've had a couple of spouses that the veterans were not service connected for Vietnam disabilities, and we ended up filing for them because they passed away from service connections that were made presumptive in 2022. So the veterans weren't aware of the benefits that they had, or they just didn't want to be a part of VA. And the spouses later on, when they found out, they came in and we got them benefits for them, for the spouses. So to date, we've gotten, I want to say, about 8 spouses that never knew they were entitled to anything. So, and then the VFW called me about another spouse who was looking for some kind of assistance or help. And when I looked into her husband's file, he passed away in 2021. In 2022, they made it all presumptive. So I'm hoping hers goes through as well. I'm waiting on that one right now, the outcome.
Okay. Anybody else? Thank you, Terry.
Again, I apologize.
Yeah,
Thank you.
our agenda is so packed, we're pretty lenient.
I did have Cody, if you need pictures for that, I've got some Adams County pictures I can give you.
Okay, Kelly, I guess the topic of the day right now,
Mhm.
what have you got to report on the SNAP and food share benefits?
Sure. So I asked Amber to come and give an update. I asked her about 2 weeks ago to give an update, and I think it's changed at least a handful of times, if not more. So she'll give an update as to where it is this moment in time.
I actually put that right in here. As of today, this information is current, but it's important to note that the situation has changed multiple times over the past few weeks, and it's likely going to change again. In October, 3,380 Adams County residents received food share benefits. That includes 2,395 adults and 985 children. It totals $528,221 with an average allotment of $263 per household. On October 10th, the U.S. Department of Agriculture's Food and Nutrition Service informed states that due to the federal government shutdown, there was not enough funding to issue November food share benefits on schedule. Then, on November 7th, the Wisconsin Department of Health Services issued November benefits to households that were enrolled on or before October 31st. Those funds are now available on Quest cards, and members were notified by text message and through updates on Access. Over this past weekend, the Trump administration ordered states to reverse full SNAP benefits sent for November. That has not happened yet. DHS is still working on benefits for households that became eligible on or after November 1st, but there's no set timeline for when those payments will be made. The status of December benefits also remains uncertain, and members are encouraged to check their Quest card balance before attempting to use it. This ongoing uncertainty highlights just how unpredictable things can be when federal funding is interrupted. It creates confusion not only for families who rely on these benefits, but also for the staff who are responsible for relaying updates and helping members navigate these changes. With Thanksgiving approaching, the delay could mean more food or more people turn to food pantries for help, and local stores may see reduced spending as a result. Food share plays a vital role in helping families, older adults, and individuals with limited income afford food, while also supporting local businesses and keeping dollars circulating within Adams County. To help fill the gap, the Health and Human Services Social Committee is hosting an agency food drive from October 27th through November 27th, collecting non-perishable food items to distribute to those in need during this time of uncertainty. Any questions I can try to answer?
Kelly?
I had asked Amber to put together the numbers so that you had a good idea of how many people in our community rely on SNAP. Because that's a significant amount of people, as well as the dollar amount, because not having that benefit will also impact our local economy. So just a reminder, that's about $525,000 that won't be coming or may come in, or whatever this issue is right now. That can impact a loss in our economy as well.
Supervisor Pease?
Thank you, Madam Chair. So going back to November 7th, when the governor authorized the benefits, and then federal government said, no, you shouldn't do that. Were they already sent out then and on people's cards? So you're not going to get back all of them no matter what, because it's already spent. Do you think that the federal government will reimburse us for at least this month, or no?
They have not given us any information at all.
Busy at a gas.
Yeah. Anyone else? Any comments? Not at this time. Mhm. Okay, review of the specialized transportation 85.21 grant projects.
Yes, every year we apply for the Specialized Transportation 8521 grant. So I just wanted to let you again know about this application for 2026. Every year, the grant amount changes a little bit. This year for 2026, it'll be $91,958. And this application requires projects to determine how funding will be utilized. This grant can be utilized also to match future grant vehicles in the 5310 grant. So we do use it two ways. Funds must be used for seniors 60 and older and or individuals with disabilities. A minimum of 18,392 of the local match is required, and local match can include volunteer time, client copay, family care revenue, or tax levy. As of September of 2025, our local match revenues include family care revenue, which is 67,400, the client copay of 13,947, and county levy of 62,183. So I don't think there will be a problem with us meeting our local match in 2026. Project 1 is our transportation for work and adult day services. For this project, we use two routes in the morning and two afternoon routes, Monday through Thursday. We have one route on Friday. And we use paid drivers who are certified in passenger assistance training, specializing in wheelchair and lift safety. The grant vehicles are used to transfer seniors and adults with disabilities to the adult day services and Practical Sense. As of September 30th of this year, we've provided 3,008 trips for this project. And then project 2 is our medical and non-medical escort. Paid and volunteer drivers are used for this. And we provide medical and non-medical transportation for seniors and adults with disabilities. Rides include pickup to and from medical appointments, dining sites, events, and other eligible activities. Paid drivers use grant vehicles, while volunteer drivers use their own vehicles. All drivers are vetted through the Department of Health and Human Services per Adams County policies. Volunteer drivers are reimbursed 58.5, that's 58 cents a mile. And then a copay or a fee is required for all users. Riders with Medicaid are directed to call the MTM services, which is a Medicaid service through the state. As of September 30th, 1,773 trips were provided through this project. And then we have our project 3, which is Find Your Own Driver. This is a project where passengers or clients hire their own driver for transportation for a destination and return. The driver can be a family member or a friend. It's their choice. Rides are for both medical and non-medical purposes. Rides are pre-approved and can be validated by the staff. The passenger is reimbursed for miles traveled. In turn, the passenger reimburses the driver that they chose. The driver meets eligibility requirements such as having a valid driver's license. Mileage reimbursements at 50 cents per mile up to $250 per month. As of September 30th, we've provided 327 trips during this project. Are there any questions regarding this grant?
Supervisor Pease?
I remember a couple of years ago, we talked about, did you ever get your new bus from that one grant? Or you got everything that we're supposed to have now?
We are awaiting on a bus right now. So we have one bus that we will be replacing out. But we've gotten our vans now, our bariatric vans and so forth. So we're just waiting on a bus at this point. During the COVID era, buses were really hard to come by, and the cost of the buses went skyrocketed, and we kind of switched out to vans versus buses as they were readily available. Right now, the buses are now becoming more available. So,
Supervisor Hick there?
Thank you. Donna, this is an application, right?
yes, for 2026.
Have we ever been denied it?
Not that I'm aware of.
Um,
Knock on some wood now.
yeah, I was gonna say, is there any jeopardy of this thing given financial situations that you're aware of?
Not that I'm aware of, not with the Department of Transportation. This is a state-funded
Yeah, I know.
grant. So,
Okay, thank you.
but you never know.
Yeah, thank you.
Any other comments from anyone? Is there anything else to be discussed by this group? Okay, our next meeting date is December 8th, 2025, excuse me, at 4 p.m. And we are now adjourned.